Hi, I'm Dr. Robert Parker from Houston, Texas, and we're here today in Denver, Colorado at our annual symposium of the Association of Extremity Nerve Surgeons. This is my favorite organization, and today I have some of my favorite doctors with me. To my right is Dr. Brian McDowell. Dr. McDowell, we're glad to have you here today. He's from Carmichael, California, and he has been doing these procedures for decades, and we're very happy to have you here today. To my left is Dr. Jim Anderson. Dr. Anderson is from Fort Collins, Colorado, and Dr. Anderson was actually part of the team that the doctors taken their training at this meeting. I actually observed him doing the procedures, and we're really thankful that you arranged all that for these doctors learning these new techniques, Dr. Anderson.
Thank you.
Okay. And to my immediate right is Dr. Richard Jacoby. Dr. Jacoby is from Scottsdale, Arizona, and have been a friend of ours for 40 years. And he is the author of a book, Sugar Crush. The reason that this book is so important is that this book is written for our patients. Before this book came out, we had no way to really explain to our patients adequately about how they became a neuropathic patient. And now this book explains this in a layman's term. So Dr. Jacoby, we're really happy to have you here today.
And I'm excited to be here as well. This has been an unbelievable meeting. I think the doctors here have really made new strides in treatment plans. When I first started to think about that book about 10 years ago, we were just strictly surgeons. We only had a surgical option other than the basic medical options. And this meeting and this book are bringing those new things to the forefront.
Exactly.
What was the reason that you felt the need to write this book about sugar and its effect upon neuropathy?
Basically because I was confused as to what the literature was telling us. The literature was telling us that there was no hope. There was no hope in the treatment of peripheral neuropathy. Now let me explain a few things about peripheral neuropathy. That means the nerves in the lower part of the body. The traditional treatment, up until we formed this organization about 15 years ago, was medicine. Medicines that work mainly in the brain. They were epileptic drugs to mask the symptoms of this disease. This book that I wrote brings into all the background of what neuropathy is, what the new treatments are, and what is the cause of neuropathy. In my opinion, sugar is the main cause for diabetic neuropathy. Now it seems rather obvious when you say diabetes because diabetes and sugar are synonymous. But why and how and to what extent does sugar cause this problem? In my opinion, the pervasiveness of sugar in the American diet is unprecedented. 80% of all the foods in the supermarket in the United States have high fructose corn syrup in them. And that sugar causes three things to happen to the nerves. It causes the tunnels where the nerves pass through to get tighter. And the nerve itself starts to swell. And the third factor is the blood supply to the nerve. Now, we're all podiatric surgeons. We've been practicing from 30 to 40 years. We're board certified in foot and ankle surgery. But 15 years ago, Dr. Lee Dellon from Johns Hopkins University brought to us a new concept of decompressing multiple nerves in the lower extremity. This was a profound and revolutionary new concept. And we have been doing this procedure for the last 15 years. But it's not the only solution for this problem. In the last 15 years, even though we get excellent results, there are many patients that have other issues with their nerves that don't need surgery. Sugar Crush outlines those conditions. Nutrition is number one. Nutraceuticals, vitamins, B6, B12, L-arginine, to name a few, are essential in preventing and reversing this disease. At this meeting today, there was excellent new research that Dr. Anderson's talked about, and Dr. Parker talked about, and Dr. McDowell, amongst other surgeons that were here. I think there's a tremendous hope for this disease. The CET that Dr. Parker talked about is a technique of electrical stimulation. It works fabulous in small fiber neuropathy. And that's the condition that starts the condition of neuropathy, where your feet are burning. So I'm very excited to hear these new concepts. A lot of them are in the book, and we talk about it in detail. The concept of lasers is another excellent modality. But essential to all these treatments is the exact diagnosis. And I think our Association of Extremity Neurosurgeons training with Dr. Dellon has taught us that the modalities that make this diagnosis, we have items like PSSD, which measures the small fiber and the large fiber, nerve conduction test. We have a new biopsy, a skin biopsy, that can assess where we are in this disease process. There are many new techniques. So the question was, why did I write this? Because it takes a lot of time to explain this disease process. If you have this problem, I encourage you to read this book. You'll be amazed at the misinformation the general medical public knows about this disease. It's not just about medicine. There are many, many more options for this disease.
You know, I'd like to comment on that too. A lot of people think, well, I'm not a diabetic, which is a fallacy, and we're going to talk about that later. But a lot of people will come to the office saying, well, there's no diabetes in my family. I'm not going to be diabetic, yet they're presenting with diabetic symptoms, but they don't realize most of the medications they're taking can bring on neuropathy. A lot of women are undergoing chemotherapy. It's a huge reason for neuropathy. There are many, many reasons. We can anywhere from 150 to 300 different reasons, and it doesn't matter the reasons. It's up to us to recognize those things and be able to treat our patients accordingly. Bob, do you have a comment about that?
When we got back from our training, all of us talk to each other probably once every week to share what we know and what we experience, and we tell our stories. And I think one of the things that was so striking that when we got back from our training, we were so ready to do all this wonderful surgery for our patients. But as Dr. Jacoby points out in his book, Sugar Crush, most of our patients aren't surgical candidates, because they are becoming a diabetic and they don't know it. In fact, their doctor's telling them, no, you're not a diabetic. But it takes 10 to 20 years through a process that we call metabolic syndrome. Metabolic syndrome has been known for years. Every physician knows that term, metabolic syndrome. And Dr. Jacoby took this concept, and in fact, in the early days, you remember our conversations about what do I do with this patient? Burning, tingling, not a diabetic. And we got onto this. In fact, you did a study in our profession that showed where the simple neuromas in people's feet, Morton's neuroma is where a nerve gets pinched in the forefoot. Well, when you have a pinched nerve here and here and here and here, it's not just a foot problem. This is a systemic problem. So we are out here thinking, what do we do for these patients? And that was 15 years ago. And so now we know what to do for these patients because we let them know very frequently before their physician does that, you're in that path to becoming a diabetic over 10 to 20 years, and you need to stop your lifestyle now and change your intake of food and pay attention to Sugar Crush. And how do we do? I used to sit and talk to patients for hours and never give them the story that Dr. Jacoby gives in this book. I just say, Mrs. Jones, you should read Sugar Crush, and when you come to see me the next time, we'll be on the same page and we can help you more. So Dr. Jacoby, we really appreciate that you've written this book.
And I'm appreciating that we're talking about it today. That reminds me of one of the stories in the book. Most people think that diabetes and diabetic neuropathy is an inevitable disease. I don't even look at it as a disease anymore. I think it's really, we're being poisoned by all the sugar we're eating. And it's a process. You can get off of sugar. You can stop this process. And there are many things you can do in the beginning phases, of what you just talked about, and we call small fiber neuropathy. And that's when the small nerves in the skin are getting burnt back, to give it a simple term. And the symptoms are burning, tingling, inability to sleep at night, and they're the early symptoms.
That's right.
And they're the symptoms that we can intervene with all these new technologies that we have. You really don't need to go on to have a surgical procedure unless it's late in the phase. But most of the doctors in the United States are telling the patients, just take your medicine and you'll be fine. And that may be true. You'll have less pain with the medicines, but the process is going on. Last year, there were close to 100,000 amputations in the United States. That doesn't have to happen. There are things we can do. And in the book, we talk about those things we can do. So obviously, changing your diet is number one. The paradigm in the United States in the treatment of diabetes is based on the cholesterol theory. Cholesterol has been deemed the culprit. Cholesterol never was the problem. It was always sugar. So eating fat is a good thing. But what we talk about in the book, which kinds of fat? You want to eat fats that are grass-fed animal fats. They are good for you. Your elevated cholesterol has nothing to do with cardiac disease and nothing to do with peripheral neuropathy. It's sugar. It's that simple. But it's confusing because every day there's an ad on television telling you the exact opposite. So this book, although maybe somewhat controversial, I challenge anybody to refute what I just said. It's sugar. It never was fat.
I might add, Dr. Jacoby, all of us now are part of the esteemed group that when we roll up to Starbucks, we request our coffee with what? Butter. So we are the hot buttered coffee team here.
Right.
And I'll never forget Dr. Jacoby pulling into the Starbucks, and I said, she said, what would you like? I said, I like cappuccino and butter. And she said, pardon me? I said, I like a cappuccino and butter. And she said, would you spell that, please? And
Right.
Yeah.
And it sounds so crazy. Yeah. When you really look at it, when you go to a restaurant, what's on the table is the poison. Poison comes in regular sugar or brown sugar, which is supposed to be better, natural. It's just dirty sugar. And then you have the different packets of yellow and pink and blue, which are the artificial sugars,
right,
which are probably worse for you than real sugar itself. But if you ask for butter to put in your coffee, which actually tastes terrific, three things will happen. It tastes great. You'll lose your appetite, and you'll probably lose a pound a day.
Exactly.
Now, they're the three bad effects of eating fat, because we were taught that fat was bad, but that is not true. Fat is good. Sugar is bad. I'll ask the question, rhetorical question, is America fat and sick or thin and healthy? And we all know the answer. 2/3 of the American population is now considered obese. And 2/3 of the cardiac disease, sudden death, and in my new book, which will be coming out next year, I have a chapter, Dead is a Bad Symptom. And the reason is because when you have a cardiac event, which we call myocardial infarction, when you go to the hospital, when they measure your blood, 50% of the patients have high cholesterol. It's true. But the other 50% have low cholesterol. It has nothing to do with the heart attack. But 2/3 of those patients have elevated sugar. Metabolic syndrome, which is just the early phase of diabetes. So I can't implore you enough, change your diet, get early recognition of this problem, and change the way you're going to live.
Dr. McDowell, excuse me.
I was
Let's let Jim
just
talk.
going to ask, I mean, because you've been speaking about sugar, but I think it might be just as interesting to talk about the carbohydrates in our diet and how that interrelates. That I read about in the book. I mean, I'm as guilty as anybody. I love my, sticky buns and my cinnamon rolls, but just explain to everybody about that.
Yes, and that was part of the reason, back to Dr. McDowell's question, why did I write the book? Because I was confused as well. The carbohydrates, a great question. Carbohydrates just means a carbon and a hydrogen and an oxygen. And in combination, we have complex carbohydrates. That is actually okay to eat if it's very complex, like the bark of a tree. But we don't eat the bark of a tree. We eat simple carbohydrates, sucrose, sugar. And they break down so quickly, they go into your bloodstream and raise your insulin. Insulin is really the problem. Insulin causes us to get fat. It's the only molecule, the hormone, that adds fat onto our body. If you eat fat, you cannot get fat because you don't have an insulin response. It's that simple. But sugar tastes great. That's why we're all addicted. It's a very difficult thing to stop. But hot butter coffee does help that because it teaches you that you're not hungry anymore. You're satisfied with the meal. So a hot buttered coffee or a high fat diet, a little bit of protein and meat and green vegetables, and that's probably all you need.
No,
And you're just not going to be hungry for the day.
That's
You know,
good.
um,
Grass-fed bacon.
I'd like to make a comment about daily what we see in our office, and people will come into the office and say, you know, I really don't know what's wrong with me. I have burning, tingling pain. I'm getting night cramps. I'm getting heavier around my girth. I'm getting hypertension, and I just don't understand it. I'm working out, and I said, well, you're a diabetic, and they always say no. And the reason for that is because the medical world is so tuned in to A1C 6 and below, blood sugar 99 and below. Well, I'd like Dr. Jacoby to talk about these people have been diabetic for 20 and 30 years and didn't even know it because it wasn't in their family. It wasn't genetic.
Right, let's go back to that genetic issue. There is a gene that causes diabetes. Type 1 diabetics is genetic disease for the most part. And that is very, very small percentage. 98% of the people we're talking about have type 2. I like to explain to the patients like this. Type 1 diabetics, actually when they come into my office, are in pretty good shape because diabetics that have type 1 genetic are dealt a very bad hand and they play it very well. Type 2 diabetics have a terrific hand in cards, is a good metaphor, but they play it very poorly because I don't have diabetes so I can eat what I want. And it's absolutely not true. But that's what we were taught with the food pyramid. Think about the food pyramid. USDA recommendation, that's the US government telling you what to eat. On the bottom of that pyramid, it says eat 6 to 11 helpings of grain a day, and that's the carbohydrate. But those carbohydrates are really sugar. And I tell my patients you should be hard pressed to eat 6 to 11 helpings a day. Well, nutritionists have told us break it up into 5 meals. So if you ate 2 carbohydrates at each meal, I guarantee you I can get you up to 350 pounds. But it's going to be hard to do. You got to eat all day long. When you eat fat, you're not hungry. You don't need 5 meals a day. I'm not even sure you need 1 meal a day for the most part, because you're really not that hungry. So carbohydrates are the basis for this problem. Carbohydrates are sugar. But we think of the table sugar, which is really sucrose, which is a disaccharide, glucose and fructose. Because glucose really is not sweet. Fructose is sweet. And that's what's in the American diet, 80%.
You know, and we keep using the word carbohydrates, and when we read a label, it'll say 28 grams of carbohydrates. Trust me, that means nothing to most people and most doctors. But what they do, what is recognizable with everybody is a teaspoon of sugar. There's not one of us here that would eat a teaspoon of sugar. Yet if you look at a label that says 28 grams of carbohydrate, which is easily found in that healthy food called yogurt, that's 7 teaspoons of sugar. We wouldn't eat that. When we look at on the label and it says sugar 4 grams, that doesn't mean, I think about how high is that. That doesn't mean a thing. What it really means is it's 1 teaspoon of sugar. I pride myself in eating healthy food. Well, I sat down with Dr. Jacoby and explained my breakfast, which was protein powder, little fruit, some water, mix it. He said, you just had 17.5 teaspoons of sugar in a protein drink.
Right. So let me explain an easy way to do that. Because reading labels is confusing. And why is it confusing? Because it's meant to be confusing. Otherwise, you wouldn't buy it. So we all like to rationalize whatever we do. But here's the way to do it. Look at the label, and if it says 26 grams of carbohydrates, divide by 4. 4 into 24 is 6. That's how many teaspoons of sugar are in that product. And that's the easy way to do it. And what Dr. McDowell just said, would you put 6 teaspoons of sugar in anything? Yogurt has more sugar than a candy bar. You wouldn't eat a candy bar for breakfast, but you are, and it's called yogurt. So here's another example. Exercise over diet. We've been taught for the last 40 years that you should exercise. One bagel has 48 grams of carbohydrates. 4 into 48 is 12. 12 teaspoons of sugar in a bagel. It takes 2 hours jumping on a trampoline to burn up that same calories. So if you take in 2,400 calories a day, you have to burn up 4,000. No one's going to do that. You can run all day long. Your grandmother didn't run, and she had an average dress size of 4 in World War II. I don't think your mother today has a dress size of 4.
Well, Dr. Jacoby, I thought a calorie in was a calorie out.
And that's what we were all taught. It's not true. There's a great book Dr. Lustig wrote, Fat Chance, that talked about the difference in sugars and how it goes through the liver. Fructose, which is a predominant sugar we eat, goes through the liver, causing it to be inflamed and interrupting these hormones, ghrelin and leptin. And that turns off the switch that tells you you're full. So you just keep on eating and keep on getting fatter. And then, of course, the government turns around and says you're not exercising enough. No, you can't exercise enough to get rid of the calories that you're taking in. Our job here at the Association of Extremity Nerve Surgeons is fundamentally to stop this process with a surgical procedure, but we're here to tell you today, start with diet. There's many things that we can do before you ever get to that. So that's what I outline in Sugar Crush, and that's what the message we want to get out to the public.
And Dr. McDowell, is it okay if I let everybody know that you're type 2 or have been a type 2 diabetic?
Yeah, I
and
was.
your experience, I'll never forget, we were at a nerve meeting in Napa, sitting at breakfast, and we're sitting around, this is years ago, and you said to Dr. Jacoby, well, look, when I'm eating this bar, remember your bar that morning?
Protein.
Zero sugar.
Healthy, zero sugar.
Zero
said
sugar.
Right on it.
Tell what your experience was.
First of all, I want to say in Dr. Jacoby's book, he has a chapter on metabolic syndrome. The only thing he didn't do was put my picture on it. but I was eating this, I really was eating healthy food, and it absolutely said zero sugar. No, right on the label, and when Dr. Jacoby did the math on it, it had 7 teaspoons of sugar on it. But more importantly, I had diabetic symptoms 30 years ago. It never once crossed my mind that I'd be a diabetic, which, by the way, is a lifestyle choice. It's embarrassing to say that, but it is. And I had symptoms 30 years ago, but diabetes wasn't my family. I was never going to get diabetes. And 1 month I went to the doctor, and there was an A1C of 7 and a blood sugar of 123, which, by the way, the next month it was back below the limits. Am I not a diabetic? Absolutely. I still am a diabetic, but now I've got really good controls, and just the combination of nutrition, understanding what I'm doing, exercise, it'll change my life, and hopefully the symptoms won't get worse.
Let me tell you my epiphany. This goes back 25 years ago, and I was working in the Scottsdale Wound Center, and basically this is before the Dellin procedure was introduced to me. And lots of people go into amputation. And I had a sudden pain in my side and got an ultrasound. I had a gallstone. And I had my gallbladder taken out about 25 years ago. Well, my mother had her gallbladder out, so I thought it was a genetic problem. When I went back to the wound care center, one of the doctors said to me, "Where were you?" And I said, "I had my gallbladder taken out." And he said, "Well, that's because," this is a true story, "you don't eat enough. The gallbladder is a muscle, and you need to eat more," which I didn't. But I must have been eating too much sugar. I started to do the research, and this goes to the book. And I found a doctor from Mayo Clinic, his name is Peter Dick, and he wrote a 2-volume book on peripheral neuropathy. In that book, he predicted that 50% of the people who had their gallbladder out will go on to become a diabetic. And I never saw that ever anywhere in any literature. So I started to ask every doctor I knew if they knew that. And no one knows that, not even today. And that got me to thinking, if it's a muscle and it's innervated by a nerve, is it getting compressed? And this nerve is the vagus nerve. When we were introduced to Dr. Dellen's theory a couple years later, I started to think, is it just the peripheral nerves or is it all nerves? My book talks about all nerves. So I was in the wound care center seeing patients on a daily basis, and I would take their history and I would say, oh, you had your gallbladder out 25 years ago. Now you have gangrene. You've had a heart attack. I started to think, wait a minute, is that me 25 years from now with diabetes, gangrene, and a heart attack? 50% of the people have their gallbladders out. And it was 800,000 patients last year had their gallbladders taken out in the United States. Do you see that on the news? No.
The other thing, Dr. Jacoby, is that sugar has become technically and medically an addiction. And I don't know if you recall the personal experience that I had with my wife, my lovely wife, who was overweight, and she had all sorts of energy problems, and she just wasn't well. And somehow she read something and found out about a facility in Buffalo Gap, Texas. And it turns out that Tenny McCarthy, who's the founder of this facility, has a sugar addiction. Not only sugar, but she also has, drug addictions and all sorts of addictions that she treats at this center. You remember me calling you and saying she's recommending that my wife come there for a week. She was there with about 8 other ladies with the same problem. And I'm going, what? Sugar addiction? This is crazy. This is just a money thing. That was truly my original thought. You remember me having this conversation.
I do.
It was and so I got a call at the end of that week, and Tenny said to me, out of the 8 ladies there, that she felt one other lady and my wife were killing themselves with sugar. And she said, I recommend your wife stays here a full month. Well, you can imagine, we had 2 children, and it was like, wow, this is going to be very difficult. Well, I asked her, and it was very interesting. She's written a book as well and had a very interesting study. Tenny not having sugar for 30-something years and so many days and hours, and another gentleman who had not had a narcotic for that similar period of time, and they ran brain scans on these 2 subjects, and the pattern, you could explain this very well, the pattern in the brain for sugar was identical to that of narcotics.
Right.
And so she stayed there a month, and it's amazing. It's changed her entire life. It's almost like a 12-step program. But you go, wait, sugar can't be an addiction. America is addicted.
And they are. And the center in the brain that causes that is called the hippocampus. And the wiring in the brain goes to that spot, where heroin addiction and sugar are the same thing to the brain.
Exactly.
And they're going to constantly make you seek out this drug because it makes you feel better.
Yep.
And that's what it's about. It makes you feel better, you get euphoric, it changes your brain chemistry. But then when the insulin comes out in your blood and it drops the sugar, the response is, I need more sugar. So you're up and down all day long. So taking drugs for your blood pressure, which is just one of those symptoms, or cholesterol, which really has nothing to do with it, but triglycerides are a fat that causes the problem.
Yeah.
So there are many, many symptoms of this disease. Gallbladder this year was now just put into the metabolic syndrome. So finally, America is starting to realize that there are many symptoms. In my book, I talk about Alzheimer's, which is, in my opinion, and Dr. Perlmutter, who wrote Grain Brain, we feel that is directly associated with all the carbohydrates we're eating, and the genetically modified ones are even worse. So it's a very complex problem. It's destroying the American healthcare system, and it's destroying our tax base as well. Mm-hmm. We're spending all this money chasing addiction. We need to change our diet, and we need to intervene on this disease process of diabetic neuropathy. We have the new modalities, we have the early detection system, and I implore whoever is watching this, get early treatment and intervention. I guarantee you, you're addicted to sugar and you don't know it.
And by the way, Shades of Hope, which is Tinny McCarty's facility, we sent her your book to Tinny, and she wrote a really nice note back to my wife, Pam, and me, saying that, I read the book. Dr. Jacoby's book is right on, and by the way, I'm putting it on my shelf in my facility. So, and her book, they have a little bookstore there, so.
If I can add one more, I don't have any epiphany, I guess, except, so mine, I was just thinking about, was probably, might have been 10 years ago, our whole family went to Europe. And our children were younger, probably junior high and high school age. But the thing that struck them, like especially when we went to Italy, was a lack of obesity over there.
Correct.
And once we started seeing and observing, and since coming back and talking to people that grew up in Europe, they don't have the soft drinks. Maybe they do now, but back then they didn't. And they just ate wholesome food, very low processed food, very low fructose, I don't think, in their diet.
That's correct.
And boy, you could see the difference. And that stuck with my children. They just didn't see as many people being obese. So
I think the big problem with the American response to this, that we can take a pill for our weakness. And the pharmaceutical companies are dominating the discussion. And that's why this meeting, the Association of Extremity Nerve Surgeons, is such an important meeting. The research that you're doing, Jim, on nerves is unparalleled, and it's going to bring a new paradigm to the medical profession. The work that Dr. Parker and Dr. McDowell are doing is equally important. We need to get this message out, because if we don't, we're just destroying not only our own health, but the health of our kids. I think personally, and from the research I've done, I think the autism is part of this process. We have 1 in 50 kids now that have autism spectrum disorder. 15 years ago it was 16 per 10,000. It's the diet. And there's a lot more issues to the sugar issue, genetically modified foods, and lots of other things that are in the food. And we don't have time to go into those items, but we need to change the way we look at this disease.
I'd like to talk a little bit with you gentlemen about the concept of what we do compared to, say, other specialties. As long as neurology has been around, they have been the go-to doctors for neuropathy. You think neuropathy, I need to see a neurologist. Our colleagues, the neurology colleagues, our chiropractic colleagues, family practitioners, all have something very valuable to offer our patients. And so when I have a brain tumor, if I have some motor loss, or I have a neurological problem, I want my neurologist, right?
Right.
But what we need to understand is that neurology has a paradigm of treatment for peripheral neuropathy. That paradigm of that treatment is to take the EMG studies, nerve conduction studies, diagnose that patient with peripheral neuropathy, but then the treatment seems to be using medications. And there's 3 common medications that they use, and I use them as well. I know you doctors use them as well. And these medications are kind of the gold standard, if you will, of treatment. Well, one of the medications says that if we have a 50% chance of, 85% chance of you being 50% better with your neuropathy. And so it's sort of a play on words to me, so
Exactly.
we were so excited in our specialty to have the ability to release these nerves, and just like you would do for a carpal tunnel,
Right.
you have tarsal tunnel in the lower extremity. So we release these different tunnels where the nerves are being entrapped, and so that is an addition to what the neurologist might use with medication. So we may have to use medications on patients, but very frequently our patients' medications are their patients off of the medication. And so then I guess my point is this: we have the chiropractic profession, which does really well with nutritional aspects and maybe the electro treatments. You have the neurologist that does well with their drugs, pain medications. You have actually pain management as well. They're primarily medications. And then we offer all of those with the addition of decompression of the nerves if the patient needs surgery. What do you think?
Right. What I'd like to really I'm eager to chime in on this, Dr. Parker, and because I tell my patients this, and when I give talks, I present it to try to simplify it, to kind of reach the public out there, is that we are kind of the third door of opportunity, meaning that when you're talking about nerve problems from the knee down, and I don't care if it's diabetic neuropathy or non-diabetic neuropathy, or maybe it's restless legs, or maybe it's drop foot. If you look at conventional medicine in our country right now, or in the world for that matter, when you're talking about nerve disorders from the knee down, you're looking at two things. Either you're going to be labeled as having neuropathy, diabetic or non-diabetic, maybe restless legs, maybe drop foot, but especially with neuropathy, you're going to be put on medication. Those are the main treatment options. You're pigeonholed into that. And then there are other patients that have been pigeonholed into thinking that it might be from their back. So they might get chiropractic care on the back. Maybe they have a nerve stimulator in their back. Maybe they have to have surgery on their back. Maybe physical therapy for their back. But those are the two opportunities to help them. It's neuropathy and you're on medication, or it's all about your back. And
so we both have a friend at Stanford who made a comment to help. But he said that this doctor said that in medicine, the fact that you have diabetes and have neuropathy is a reason not to look any further.
Exactly.
To your point.
It stops the whole thought or the question of anything. So from the knee down, what we've been trained to do and I feel it's much more precise and gets to the diagnosis and gets to the bottom line of what's really going on with that patient. We're looking at these 5 specific nerve tunnels. And that's what nobody else does except the Association of Extremity Nerve Surgeons. We're focusing on what I call the third door of opportunity, because most people don't look at that door. Most medical people don't. And patients come in and they've been to a doctor that's putting them on medication. They've been to another doctor that's maybe recommending that they have their back looked at. They're very confused, and their eyes just get about this big when we start talking to them about these nerve tunnels from the knee down, and that's what excites me.
Gentlemen, thank you. It's been a great conversation today with all of the discussion about sugar, the poison, the addiction, and also we've really enjoyed talking about all the different available new treatments and new concepts in neuropathy today. And if you're interested in joining us, please join us at parkerpodiatry.com, or you can call us at 281-497-2850.